Whether you sleep, sit, talk, walk, or just minding your own business in your day-to-day life, there's a never-ending battle going on between you and your enemies in your body for the sake of your healthy body. Those enemies are called as pathogens. The pathogens is an organism which causes disease, and there are 4 of them. Number 1st, virus. Number 2nd, bacteria. Number 3rd, parasite. And number 4th, fungi. Starting with number 1st, virus. Viruses are those infectious agents that invade and reproduce inside cells and causing disease such as cold, chickenpox, and flu. Number 2nd, bacteria, or those single-celled microscopic organisms that release toxins and cause disease such as food poisoning and sore throats. Number 3rd, parasites, organisms such as tapeworm that makes the body their own food source. And lastly, the fungi, molds that infect the skin causing irritation such as athlete's foot. Our body has several lines of defense against pathogens or germs. The skin acts as a barrier to stop pathogens, while chemical in tears and acid stomach juices also deter bacteria. Pathogens that do breach these defenses are targeted by the white blood cells and other weapons of the immune system, or we can say the defense system. The white blood target pathogens in a number of ways. Microphages, for example, are white blood cells that have left the body vessel in search for bacterial infection. They engulf bacteria and kill the ingested pathogen. But when body's immune system doesn't have what it takes to completely eliminate the pathogens, then it's the vaccine which makes way. Vaccination can provide the body with the immunity to certain disease. When you're given a vaccination, your body is ingested with substances that triggers the body immune system cells to produce antibodies. The first vaccination is given by British doctor Edward Jenner in 1796. The word vaccine comes from vec, the Latin word for cow. But before the vaccination, the doctors need to find out the disease by testing some of the specific symptoms and signs. Symptoms are things experienced by the patient such as pain or swelling, signs or what doctor observed during the physical examination and result of medical tests. Test includes number 1st, stethoscope to listen to heart and check the heartbeat sounds strong and regular. Number 2nd, reflex hammer to test reflexes in your nervous system and your spinal cord. Tongue depressor to examine the mouth and the throat for sign for inflammation or infections. Thermometer to measure the body temperature, which can be indicator of understanding infection. And lastly, the scales to check the body weight to make sure that patient isn't gaining too much weight or losing too much. After many of these checkups, doctor prescribe the most appropriate and suitable medicine for the pathogens for a particular dose for a time of period for its best possible use. For any minor injury, for example a simple cut, or your immune system makes a really complex work to keeping you protected. At first, it releases histamine to widen blood cell vessel and provide access to white blood cells to destroy pathogens in the cut and make platelets to become sticky and group together. Release chemicals from platelets and tissue around the cut to create strands to protein called fibrin. After that, it uses platelets to form plug to stop bleeding and net of fibrin threads to trap red blood cells and form a clot to reinforce the platelet plug. Form a scab around the cut surface to protect the area and produce new skin cells from wounded tissue to repair, which all combines and completed the process called healing a cut.